Azdawatetun. Thank you. And that's written on Farsi except for some say Gorbze, Gorbe Samze, that's it. We're going to talk today about how you might choose amongst a whole variety of different things to make a good wellness plan and let you know about what we have at our center which will help you do that. So next slide, please. So as you know, and if you've ever tried to treat yourself, especially here in Los Angeles, there are hundreds and hundreds of things you can choose from, both within the conventional community and in the alternative community, and the choice can sometimes be very overwhelming. And it depends a bit on what stage you are. Are you trying to prevent a cancer? Are you in the middle of treatment? Are you trying to recover? Or are you trying to prevent ever having to do this again? And those of you who've done it once, in the audience, I know I've met some of you, you know once is well more than enough. So next slide, please. So why should we do this? People come to me all the time and say, I want to cure this cancer. And I want to be very clear. These therapies are supportive, they're very important, but they don't cure cancer by themselves. So the things that we think are useful here, you can reduce your cancer risk, absolutely. You can support your immune system, which then works on your behalf to help find cancer cells. You can manage symptoms that occur during the time of treatment or can occur later as a result of treatment. So any woman who's gone through treatment for breast cancer knows that menopause can come quite quickly and abruptly. You might develop pain or nerve pain as a result of treatment. You could be very anxious or depressed, and everyone comes to me with a strong feeling of a loss of control, that things are being done to them, and these therapies and this idea and this way of thinking about treatment really empowers you to become an active part in your treatment. And happily, most of the things that are good for cancer prevention are also good for other common illnesses like heart disease. And you know, we will cure you from one thing, but unfortunately we never get away from having to worry about risk no matter what. And these strategies really do make a difference. Next slide. So we're going to talk in generalities today about things that everyone should think about. But any plan that's made, if you individualize it for each individual person, their very particular circumstances, you get a much more powerful effect. But today I'm going to talk to you about some general things that we should all be doing. Next. So your diet needs to be optimal. You need to exercise regularly. The weight issue you already heard about. Practice regular stress management. This past week that's been quite difficult for most of you. Go to your conventional doctor. That's a big part of this treatment. These things work hand in hand. And when you do use supplements, pick them carefully, make sure they're well made, get expert help with that. And part of what we've done today is bring you some things from our centers so that you could see what good supplements look like, and they're in the back, and I invite you to go meet the ladies back there. And when there is evidence in the medical literature, that's what should guide therapy. Now, unfortunately, there are not enough clinical trials to answer every question with certainty, but where we do have evidence, we like to follow it. Next, please. Next slide. Oh, good. So the first thing is, this is what your doctor should be doing, taking your order about your food. So as the very old Dr. Hippocrates, who is the father of modern Western medicine, said, let food be your medicine and let your medicine be food. So we're going to first start to talk about food. Next slide. Happily for us, many, many, many foods, especially many spices, and many spices that were common in the Mediterranean area, have anti-cancer effects. And so these things put into your diet do help reduce your overall risk of cancer. And this is one of the reasons why we strongly recommend spices, fruits, and vegetables for patients, because they have probably an additive effect when you put all these things in a diet together. Next slide, please. So this is what your plate should look like. Not cheeseburger, French fries, no. Half of your plate, half, should be fruits and vegetables. The next should be fish, or a plant-based protein like tofu, or a very lean meat, and then a little bit of grains, not very much fat. That's what your plate should look like. And most of us in America eat the opposite. We have a lot of starch, we have a lot of meat, and we sometimes have very little vegetables. Next slide. So you need to eat 7 to 9 servings of fruits and vegetables a day. In the United States, half of the people in the United States do not even eat 1 piece of fruit a day. So I'm going to ask you not to look at your neighbors. How many of you had at least 3 servings of fruit today? Pretty good. Okay, back 1 slide. I'm not done yelling at them about this yet. Okay. So it tells you there what the servings are. It's less than you think, but at every meal you should really endeavor to include a fruit and a vegetable with every meal. Next slide. Now, if we're choosing for certain foods, we're choosing to have less of other foods. So the first thing up there in the left-hand corner, none of those fatty meats. Any of you like sausages? Get over it. You should have much less meat than we normally do, and the less fat the meat has, the better. You should really not go for fast food because that's really an oxymoron. It might be fast, but it's not really food. Much less wine, and especially if you're talking about cancer risk, I think there really is not much place for drinking regularly at all. And much less simple carbohydrates. Those nice cakes and cookies on the back table, which were glorious, probably are things that should be treat foods and not everyday foods. Next slide. So this is what you should be choosing. 7 to 9 servings of fruits and vegetables, less saturated fat, more plant-based proteins, organic food where possible, and sometimes for certain kinds of foods that's more important than others, not many simple carbohydrates. Next slide. Now, you have to move. We have a culture where we sit in the car, we stay on our computers, we don't do work in the process, physical work in the process of our day. And we were designed as humans to be very active in using our bodies. So you need to be really doing 30 minutes of sustained exercise most days. And it should be a variety of things. So you can do aerobic exercise like the swimming and the soccer and the dancing, which I imagine we'll have a little bit of later on perhaps, biking. But you also need to use weights to stay strong. And this is both for women and men. The more that you support your lean tissue, the stronger you're going to be, the easier it will be to maintain your weight, and that will lower your cancer risk for all cancers that have anything to do with hormones for both men and women. Next slide. So how do you start exercising? Make sure it's safe for you physically. And be consistent. Pick out different kinds of exercise so you don't get bored. And have a partner. Exercise with somebody. Get a trainer. Those of you who have grandchildren, get them to come do stuff with you. And really make your exercise part of your everyday life as much as you can. This is critically important. It's one of the things that we do very little of in our culture today. Next slide. Now, if you are going to think about a supplement, should you do a food or should you do a supplement? In general, if something can be gotten through the diet, I think that's the best way to do it. It's close to the way the body's used to getting it. It's in a complex matrix. You get all the fiber, all the nutrients. I don't think we get the same effect when we start to pick out just one piece of something to give. And there are lots of spices, garlic, turmeric, many other things that have good effects and good anti-cancer effects that can be included in a diet regularly. But some things you may need to increase